Dr. Phillip Snell, welcome back to FixYourOwnBack.com. Let's talk a little bit now about exercises that we can do to try to keep the hip, the knee, and the foot working well together so that we can help to prevent injuries in runners and help to prevent knee pain and hip pain in all of our patients out there. We've already talked in the last installment on the basic etiology of how these particular areas work together, especially how tight hip flexors can influence the hip extensors or the gluteal or buttock muscles and cause problems in the way the lower extremity tracks, especially in the way the knee works. So we want to correct that. If we have a problem of tightness in the hip flexors and the gluteal muscles aren't working so well, it would be nice to have an exercise that addresses both of those at the same time, and just so happens that we do. We have one that is called a single leg static lunge or static squat. To do that, I'm going to support my foot on a bench here behind me. And I want to set myself up so that my knee, my front foot, is directly over my ankle. And I'm going to drop backwards and down. Notice from the angle that you're looking at it from the camera here, my knee is not going too far forward. It's certainly not going in front of my toes, right? This is a balance exercise. Focus on trying to keep your knee in good position here as you go up and down. As you can see, my stool is moving around a little bit, and that presents a nice balance challenge there too. Okay? Up and down, focusing on taking the back leg down. As you come up, push out of your heel so that you can feel your gluteal muscles on your stance leg working back here. Some of you are going to feel the tightness on the front side of the other leg that's back up on your stool. Some of you are going to feel the tightness on the front side of that hip from the tightness in the hip flexors. That's okay. That's a good thing. That means you're stretching out that tight area. At the same time, on the opposite leg, you're strengthening the gluteal muscles. Let's take a look at what that looks like from the front side now. Now from the front, you can see that the knee is staying straight over the ankle. It is not going towards midline. Some of you that are challenged with balance a little bit might need a wall to prop against, but notice as I drop back and down into my back leg, I'm stretching this side, and my two things that I'm trying to remember here are do not let the knee go too far forward or too far inside, okay? Not forward and not inside. Again, you're getting a good workout in your rear end back here as you push out of your heel in your stance leg. The next exercise we'll do is called the hip airplane. This particular exercise was described when I first saw it by Dr. Stuart McGill. Professor McGill is one of the foremost spine researchers in the world. I like this one because it incorporates balance and also puts the hip muscles, the gluteal muscles, through a full range of motion. You start by standing on one leg. Right here I'm standing on my left leg. You make your core nice and strong and active. You put your arms out like you're an airplane. My arms are a little bit restricted here because I'm a little bit too close to the wall, but you might want to get out to where you can stretch out completely. With your core solid, hinge at your hip joint and take your back leg back. Root into the floor. Feel your feet gripping strongly into the floor. Now your body and your back leg should be at about a 45-degree angle. In that position, keeping your hips and shoulders locked down, open up and rotate all the way out to one side. You can see the balance is a little bit challenged here. And then rotate all the way into the other side. We get full range of motion and stretch there. And then on the other side, we get a real nice contraction of the gluteal muscles. As we play with that for a bit more, and you get a little more proficient with it, we can start to add more fun motions to it and make it a bit more challenging and almost plyometric. But for right now, the hip airplane is a good one for developing range of motion, and balance control. The last exercise we're going to do for the hips is one that I call the disco or the hip hike. In a single leg stand, balancing on one leg, I want you to drop your hip out to the side. Some of you may know this as a Trendelenburg test from neurology testing. You drop it out and then pick it up. Drop it out and then pick it up. Drop it out, pick it up. Now I'm working my left hip here. As you drop it out and pick it up, some of you may want to put on some music and get a little dance on. But I like to use this one as a finishing exercise after the other two. Why? Because it's going to get a killer burn right there in your butt. The other thing I really like about these exercises, guys, is you don't have to change clothes. I intentionally came in here in my clinic wear today just after work to show you this, because this will give you a good workout in your hips and in your hip flexors, but it's not going to be something that you need to budget time for. You only need 5 minutes here or there during the day to drop off of your chair and to do a few of these exercises. In the process, you're going to lengthen your hip flexors on one side, which allows the gluteal muscles to function better, and at the same time you're training the gluteal muscles to control your leg. How will that work out when you're running and playing? Is that knee is not going to fall towards midline and put you at risk of injury. I hope you find it helpful. I'm Dr. Phillip Snell, and this is FixYourOwnBack.com.